Hi everyone, I'm Michelle. Welcome back to You Therapy. This video today is going to be an introduction to ACT therapy. I really liked ACT therapy for a number of reasons. One is that it's mindfulness based. Two, it's also very much about compassion and acceptance of one's experiences. And I think those things are very important, learning self-compassion. ACT therapy teaches us to behave in ways that are consistent with our values and to develop psychological flexibility. When we're inflexible, we know from a lot of research, we can have a lot of problems come up and have a lot of challenges come up. So learning psychological flexibility is a great skill to have. Another reason I like ACT is because we can learn a lot of components on our own. You can get an ACT workbook and do a lot of the exercises and reap the benefits from it without a therapist. With a therapist, however, that is trained in ACT, it can be even more beneficial because that person can help to really guide us in looking at the ways we may suppress, manage, try to control our emotions, and that can be problematic. And sometimes with a therapist, it's more helpful to have those questions kind of explored more deeply. ACT really teaches us that pain is normal. It is how we think about pain that is the problem. So maybe consider that for a moment if you're willing. Your pain is normal, but it may be how you're thinking about it that is really causing you the distress. Unwanted emotional experiences are not the problem. You are not a flawed person. You are not a damaged person. How can we change the way we think about and react to our emotions rather than trying getting rid of our thoughts and emotions? And that's what ACT really helps us do. There's such a wide spectrum of emotional experiences, and ACT really addresses that and acknowledges that. And I think that's so important because sometimes, with self-help, with therapy even, we may get this message that we're supposed to fit into this certain perfect box of behavior and feelings and thoughts. And it can, sort of reduce what makes us unique, what makes us who we are. And we don't want to do that. What we want to do is just get things out of the way that are in our way for having, our most, our biggest self come out, our best self come out. I'm not putting it well today. I have a sinus infection, so please forgive me if I'm kind of having a little difficulty with this today. But I think it's such an important therapy that I really wanted to do a video about it. So if you have any questions, if things I say today aren't clear, I really hope you'll leave me a question in the comments, and I'll try to answer those questions when I'm a little less kind of sick. So let's talk about some of the things that an ACT, the ACT philosophy says are problematic. And I have my little cheat sheet board here again, an acronym, FEAR. And you know how us mental health people love our acronyms. So the first thing that the ACT philosophy considers to be a problem is fusion with our thoughts. And I've talked about this before with CBT as well. When we really identify with our thoughts, we really believe our thoughts intensely, that can be a real problem for us. So think of a thought you may think of often that's painful. And notice what happens when you start to disengage from it, let go of it a little bit, and see if there's a difference in how you feel. So some of the thoughts that can be problems that we can be fused with is, no one likes me, I'll never get better. I know what they're thinking about me. There's a lot of really negative thoughts that we can be fused with that can cause us a lot of pain. The second is evaluation of our experience, kind of a judgment that is negative about who we are and what our experience is, and saying that we shouldn't have it, it shouldn't be. And that can get us into trouble. That can cause us challenges as well. And also avoidance of our experiences, especially our feelings. Again, like I've said before, with the things that we do that cause us trouble, it's very understandable. We would want to avoid pain. That's a human reaction to pain. It's understandable. But when we avoid our feelings, they tend to get bigger. They tend to get in our way more. So doing the opposite of what we feel like doing can actually help us heal. And reason giving for our behavior. Reason giving is kind of like defensiveness. So when we reason give to ourselves and to others, we don't leave room for change. We don't leave room for empathy. We don't leave any space to learn and grow and to really take responsibility for behaviors that have been hurtful to ourselves or to other people. So this FEAR acronym are things to perhaps keep in mind, and these are things you would go through with your therapist or in your workbook with activities, and really explore ways that you may be doing any of these things. And just having the realization, the noticing of what you're doing is that first step, as we know, toward doing something different that can be helpful to us. So what are the things that are helpful, have been found empirically to be helpful in ACT? So the first is acceptance of our experiences, acceptance of ourselves, and of reality. And some people have difficulty with acceptance because they feel it means we're saying it's okay to have done that. It's okay that someone did that to us. And acceptance doesn't mean that. Acceptance is just you're not fighting with what is or what was, with reality. When you stop fighting that, something happened that was painful to you, you can make a change, you can learn, and you can grow. The second piece is choosing our life direction, choosing how you want to live. And again, through exercises, through question and answering, we start to really explore with the C what our deepest values are. What is really important to us as goals in our lives. What kind of person do we want to be in the world, and making the choice. And the C can also be commitment to that choice, committing to being that way in the world, committing toward the T, taking action on this behavior, this goal. So the T is, working towards taking actions in behaviors that move you in the direction that you want to go in your life, toward the goals that you have for yourself, be it how you want to treat yourself, how you want to treat others, what you want to bring into your life, what you'd like to have less of in your life. And so this is really breaking down a lot of kind of complex exercises that you can be doing with ACT, because it will really go into ways that you can begin to take action, how to go about creating action steps for yourself. So that is ACT therapy. I hope that you'll, be interested to explore it a little bit more, or leave me questions if you have any questions about ACT. And I also hope that you will give yourself credit for taking some time to learn about ways to help yourself today. Thank you so much for watching. Take care.